What type of joint is the intravertebral disc joint? Your options are hinge, ball and socket, cartilaginous or synovial. The correct answer is C, that is cartilaginous. The intravertebral discs are cartilaginous joints that provide flexibility and cushioning between the vertebrae. These joints allow slight movement while absorbing shocks. This helps to protect the spinal cord and maintain the spine's structural integrity. Question number 27. The joint between the teeth and the jawbone is classified as. Your options are hinge, fibrous, synovial or cartilaginous. The correct answer is B, that is fibrous. The gomphosis is a fibrous joint where the teeth are securely anchored in the jawbone sockets. This joint is immovable and provides stability for the teeth. It is reinforced by periodontal ligaments, which hold the teeth firmly in place. Question number 28. The sternoclavicular joint is what type of joint? Your options are hinge, saddle, ball and socket or condyloid. The correct answer is B, that is saddle. The sternoclavicular joint is a saddle joint that allows various movements of the clavicle, including elevation and depression. It also plays a critical role in shoulder and arm mobility. This joint enables the clavicle to move in multiple planes, facilitating complex shoulder movements. Question number 29. Which type of joint is the temporomandibular joint, TMJ? Your options are hinge, condyloid, pivot or plane. The correct answer is B, that is condyloid. The temporomandibular joint, TMJ, is a condyloid joint that allows both the hinge and gliding movements of the jaw. It facilitates opening, closing and side-to-side movements of the mouth. This joint crucial for chewing, speaking and other jaw functions. Question number 30. The costovertebral joints are classified as. Your options are hinge, ball and socket, plane or pivot. The correct answer is C, that is plane. The costovertebral joints are plane joints that allow slight gliding movements between the ribs and vertebrae. These joints enable the ribcage to expand and contract during breathing. They provide flexibility and support to the thoracic region of the spine. Question number 31. Which type of joint allows for the rotational movement of the head? Your options are hinge, ball and socket, pivot, saddle. The correct answer is C, that is pivot. The atlantoaxial joint, a pivot joint, allows for the rotational movement of the head, such as turning it from side to side. This joint is located between the first and second cervical vertebrae. It plays a crucial role in neck mobility, enabling the head to rotate. Question number 32. The metatarsophalangeal joints in the foot are classified as hinge, ball and socket, condyloid or pivot. The correct answer is C, that is condyloid. The metatarsophalangeal joints are condylar joints that allow flexion, extension, and limited rotation of the toes. These joints are essential for walking and maintaining balance. They provide a range of motions necessary for foot movement and stability. Question number 33. What type of joint is the zygapophyseal joint, facet joint in the spine? Your options are hinge, plane, ball and socket, or pivot. The correct answer is B, that is plane. The zygapophyseal joints, facet joints, are plane joints that allow gliding movements between the vertebrae. The joints provide flexibility and stability to the spine. They also enable the spine to bend and twist while maintaining its structural integrity. Question number 34. The ankle joint is an example of which type of joint? Your options are hinge, saddle, pivot, or ball and socket. The correct answer is A, that is hinge. The ankle joint is a hinge joint that allows dorsiflexion and plantar flexion, meaning it enables the foot to move up and down. This joint is crucial for walking, running, and jumping. It provides stability while allowing a significant range of motions in the foot. Question number 35. Which type of joint connects the radius and ulna in the forearm? Your options are hinge, syndesmosis, ball and socket, or pivot. The correct answer is B, that is syndesmosis. The radioulnar syndesmosis is a fibrous joint connecting the radius and ulna, allowing slight movement. It also helps to stabilize the forearm bones while permitting rotational movements like pronations and supination. This joint plays a key role in the function of the forearm and wrist. Hello friends, welcome back to Dear Competitive Exam YouTube channel. Today you are attending 100 most repeated and most important question answer session based on human joints. And this is the part 2 of the series. I'm sure that you don't want to miss the first part, because as first part contains lots of very important questions that makes you more fit for your upcoming exams. So do watch this video completely to make yourself more fit to answer any kind of questions. And at the end, if you find this video helpful, then please do like, subscribe and share this video to all your friends who are preparing for upcoming any kinds of medical exams. Let's continue. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of the channel has been given in the description. Let's continue. Question number 36. The intercarpal joints of the wrist are classified as hinge, plane, pivot, or saddle. The correct answer is B, that is plane. The intercarpal joints are plane joints that allow slight gliding movements between the carpal bones and the wrist. These joints contribute to the flexibility and range of motions in the wrist. They play a vital role in wrist movements like flexion, extension, and radial and ulnar deviation. Question number 37. Which type of joint is found between the sternum and the ribs? Your options are hinge, ball and socket, cartilaginous, or synovial? The correct answer is C, that is cartilaginous. The costochondral joints between the sternum and the ribs are cartilaginous joints, allowing minimal movement. The joints provide stability and flexibility to the rib cage during breathing. They also help to protect the vital organs like the heart and the lungs while enabling the chest to expand and contract. Question number 38. The articulation between the occipital bone and the atlas is which type of joint? The options are hinge, condyloid, pivot, or ball and socket. The correct answer is B, that is condyloid. The atlanto-occipital joint is a condylar joint that enable flexion, extension, and lateral movement of the head. This joint allows the head to nod and tilt, providing a range of motions in the neck. It plays a crucial role in head and neck mobility, especially in everyday activities like looking up or down. Question number 39. The distal tibiofibular joint is what type of joint? The options are hinge, syndesmosis, ball and socket, or pivot. The correct answer is B, that is syndesmosis. The distal tibiofibular joint is a syndesmosis, a type of fibular joint that allows slight movement between the tibia and fibula. It helps to maintain the stability of the ankle while allowing flexibility. This joint also plays a key role in overall function of the lower leg and foot. Question number 40. Which joint type is found at the base of the thumb? The options are hinge, saddle, pivot, or condyloid. The correct answer is B, that is saddle. The carpometacarpal joint of the thumb is a saddle joint, allowing for a wide range of thumb movements, including apposition. This joint is essential for grasping and manipulating objects. It provides the thumb with the flexibility and strength needed for various hand functions. Question number 41. What type of joint is found between the ribs and vertebrae? The options are hinge, plane, pivot, or ball and socket. The correct answer is B, that is plane. The costovertebral joints are plane joints that allow slight gliding movements during breathing, helping the rib cage to expand and contract. These joints are crucial for maintaining the flexibility and stability of the thoracic spine. They play an important role in the respiratory process by enabling rib movement. Question number 42. Which type of joint connects the humerus and ulna? The options are hinge, ball and socket, pivot, or condyloid. The correct answer is A, that is hinge. The elbow joint is a hinge joint that primarily allows flexion and extension, enabling the arm to bend and strengthen. This joint is essential for various daily activities such as lifting and pushing. It provides stability while allowing a significant range of motion in the forearm. Question number 43. The radiocarpal joint in the wrist is classified as hinge, plane, condyloid, or pivot. The correct answer is C, that is condyloid. The radiocarpal joint is a condylar joint that allows flexion, extension, and circumduction of the wrist. It provides a wide range of motions, enabling complex wrist movements. This joint is critical for hand functions like grasping, rotating, and tilting. Question number 45. Which type of joint is the acromyoclavicular joint? Your options are hinge, plane, pivot, or saddle. The correct answer is B, that is plane. The acromyoclavicular joint is a plane joint that allows gliding movements between the acromion and clavicle. This joint plays a key role in shoulder movement and stability. It enables the shoulder to perform a variety of motions, including elevation and depression. Question number 46. The joint between the femur and tibia in the knee is what type of joint? Your options are hinge, ball and socket, pivot, or condyloid. The correct answer is A, that is hinge. The knee joint is a hinge joint that primarily allows flexion and extension, enabling leg movements like walking and running. This joint provides stability while supporting the body's weight. It is crucial for performing various lower limb functions, including standing, jumping, and squatting. Question number 47. Which type of joint is found in the knuckles metacarpophalangeal joints? Your options are hinge, condyloid, pivot, or saddle. The correct answer is B, that is condyloid. The metacarpophalangeal joint are condyloid joints that allow flexion, extension, and slight rotation of the fingers. These joints are very important for gripping and manipulating objects. They provide a range of motions necessary for hand movements like clenching and spreading the fingers. Question number 48. The hip joint is an example of which type of joint? Your options are hinge, pivot, ball and socket, or saddle. The correct answer is C, that is ball and socket. The hip joint is a ball and socket joint that allows for a wide range of movements, including flexion, extension, abduction, and rotation. This joint provides stability and flexibility, making it crucial for activities like walking, running, and climbing. It supports the body's weight and enables powerful leg movements. Question number 49. Which type of joint allows for the rotational movement of the forearm? The options are hinge, pivot, ball and socket, or condyloid. The correct answer is B, that is pivot. The proximal radioulnar joint is a pivot joint that allows rotational movement of the forearm, enabling pronation and supination. The joint is essential for movements like turning the hand palm up or down. It provides forearm with the flexibility needed for various tasks. Question number 50. The joint between the atlas and axis in the neck is classified as hinge, pivot, ball and socket, or condyloid. The correct answer is B, that is pivot. The atlantoaxial joint is a pivot joint that allows the rotation of the head, enabling side-to-side movements. The joint is crucial for neck mobility and functions like looking over the shoulder. It plays a key role in maintaining head and neck flexibility. Friends, it's a time to comment your score out of 25 questions. And friends, thanks for joining us on this exciting journey. If you enjoyed the quiz and learned something new, then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you. Take care.